their support for this event. We'd like to recognize all of those that are in attendance today, including Dr. Brendel. There she is. Say hey.
Hello, everybody.
Sorry, I just got done mic checking her too. Dr. Brendel, everyone, on the mic. All right. Dr. Vazzi, Dr. Pai, Dr. Taylor Desir, and Dr. A. Sunye. All right, we're going to get started. I don't know what's wrong with me today. We're going to get started here very shortly with the program, and we would like to ask everybody to sort of kind of start coming this way and gathering around behind the timing trailer. There we go. There they come. I see them. We see you guys. You're all troopers. You're not afraid of a little bit of rain, are you? Come on, let's make some noise. You're not afraid of a little bit of rain, are you? There we go. That's what I'm talking about. Fantastic. All right. All right, so who's going to be the first one up on the hot mic today? Dr. Brendel? All right. Here we go.
Everybody? Good morning. That was really weak. Let's do that again. Good morning, everybody.
Good morning.
All right, that's more like it. Hello and welcome to the second annual APA More Equity in Mental Health 5K. We're not going to let a little rain get in the way of our spirit, are we?
No way.
All right. I'm happy to be with you all today and so grateful for you for dedicating your time to participate in this run, walk, and roll event. We are all here to increase awareness and to personally engage in the effort to address mental health inequities in our country and to support young people of color. In just a few minutes, Raul Andrews, Executive Director of the APA Foundation, will speak to us about how the fundraising we've all done together will support innovative mental health work by community organizations. But first, I want to say a few words about this particular event. This event is hosted in July. Clearly today it's not because of the weather, but it's because it's Bebe Moore Campbell Minority Mental Health Awareness Month. Today, APA joins our partners for this community event to recognize and honor Bebe Moore Campbell and her advocacy for mental health. We are inspired by Bebe Moore Campbell's life and her work, and we're committed to pursuing mental health equity for young people of color and mental health for all people who struggle with mental illness and substance use disorders in America. Confronting systemic racism and the persistent factors impacting mental health that stem from it is no easy task, which is why your engagement and support for the programs organized by the APA Foundation, and our partners is so critical. Thank you again to each of you for being here, for contributing, and thank you to our partners for supporting this effort. I look forward to a great day with all of you. We will now hear from Dr. Regina James, APA's Deputy Medical Director and Chief of the Division of Diversity and Health Equity. Her team, Dr. James! Let me just say that her team, recognized her team and all the work they've done to spearhead this event and the More Equity and Mental Health Initiative. So to Dr. James and her staff at the Division of Diversity and Health Equity, Dr. James.
Thank you, and good morning, everyone. Thanks for coming out in all of this light rain. Thank you, Dr. Brendel, again, and thanks to all of you. I know it's a little bit misty, but we'll make it. Just want to give a little background here. When I started at the APA, it was actually during the COVID-19 pandemic, and as we all know, there was a lot going on, right? There were social injustices, families were experiencing losses, there was loved ones, job losses, and people were experiencing social isolation. I know that COVID-19 disproportionately impacted communities of color, but also knowing that Black and brown young people were among the most vulnerable to COVID-19, with high mental health service needs and low mental health service utilization. So it only seemed natural to me that the American Psychiatric Association, the largest psychiatric membership organization in the world, could lead an effort that would bring more visibility and more awareness to these unmet mental health needs during these unprecedented times. Hence, the 5K initiative was developed. But why a 5K? So besides the physical and mental health benefits that you can get from a 5K, we wanted to find a way to bring people together to truly bring more awareness around this issue of unmet mental health needs of young people of color. We then turned to our colleagues at the American Psychiatric Association Foundation to help fundraise. We could then put those funds back into the community with organizations who have boots on the ground that are actually working with young people of color with mental illness and substance use disorders. So we are now here in our second year. Let's just give a hand for that second year. And fortunately, we have expanded our activities under the More Equity and Mental Health Initiative. So in addition to the 5K that you all are in today, we also have a mental health fair. So we're going to be partnering with Howard University Hospital on July 23rd from 10 to 2 on the lawn of the hospital and have a community fair. We'll have a number of organizations who provide health care services to folks in the DMV, as well as the APA being represented. Again, to bring more awareness and to distribute resources to communities that we serve. There's also going to be a series of roundtable discussions around normalizing these conversations around mental illness, destigmatizing mental illness, and sharing mental health resources. So we started off with Dominique Dawes in the beginning of July. We're going to focus on advocacy, and we're going to have the grantees who actually benefited from last year's 5K talk about what they're doing with their funds. So on behalf of the American Psychiatric Association, I want to thank all of you so much for being here. You have no idea how much of a difference you're making. Thank you again. Now I'd like to introduce my esteemed colleague, Mr. Raul Andrews Esquire, Executive Director of the APA Foundation.
Good morning. Dear Stigma, we don't care if it's sunshine and we don't care if it's rain. We're gonna kick your tail. And these runners out here are gonna help us kick your tail so that we will beat back stigma and increase mental health equity. Thank you so much for being here. We have nearly 400 registrants across the United States and North America. Over 40 teams. Only had 21 last year. We have 12 of our district branches across the country who have joined this movement to get more equity in 5K, and they're hosting races all over the country today. But here we are at Anacostia Park. And for those of you who spend any time in the DMV, you know we could have done this race anywhere. We're east of the river on purpose. You're east of the river on purpose to drive more equity in mental health. So thank you so much for coming east of the river. You know, we give our tribute to the Anacostans, the indigenous people who actually lived on this land. You're going to be running on the land of those indigenous people. Let's give them their due. We also know, because it's Minority Mental Health Month, that there are unserved and underserved audiences, caregivers, families struggling, trying to figure it out. It's because of your time. It's because of your talent. It's because of your treasure. We're going to be able to do more to build more equity. In particular, we have our sponsors we've already thanked many times, and we'll continue to do that. You'll see their names over on the banner. You'll also see them on the back of your t-shirts. But our presenting sponsor is Janssen Pharmaceuticals. Peter and Nick, I don't know where you are, but I know you're here. They came through New York to come all the way down to DC. Peter, Nick, I can't see you. Let us see you. There you go. They're going to be out there running, walking, and rolling with you. Peter, you want to come up? Nick, as they're walking up, finally, you're near the finish and the start line. I want you to be safe. I want you to be careful out there. But I want you to keep in mind Dr. King's legacy of the fierce urgency of now. As you're looking about your time when you do your race, walk, run, or roll, we don't have time to waste. So every footstep you take is going to be making a difference as we knock down stigma and build mental health. So thank you very much, and I look forward to seeing you all at the finish line. Let's get it done. Dr. Brindell, you want to close us out?
Thank you. Thank you, Raul. All right, are you ready? Let me hear that one more time. Are you ready? All right. Thank you to our sponsors. Thank you to our partners. Thank you to all of you. And let's walk, run, and roll.
All right, ladies and gentlemen, let's hear it for Dr. Brindell. Let's hear it for Dr. Regina James. And let's hear it for our esteemed colleague, Raul Andrews, Esquire. Ladies and gentlemen, again, we'd also like to give a big shout out to Janssen Pharmaceuticals and Endeavor. Yeah, there they are. We see you guys. All right. Endeavor, SI, Truist, Xerox, and the Austin Riggs Center, as well as the entire APA Board of Trustees and their foundation board of directors. We are on track for an on-time start. We've got about 5 minutes to go. We're going to go ahead and play a little bit of music, then we're going to have the national anthem, and then you guys are off and running. Oh, sorry, we got one more quick announcement.
I forgot the most important thing. We would not be here and we could not be here without the amazing staff of the APA Foundation and the APA, especially the Division of Diversity and Health Equity. So join me one more time in giving them a shout out. Thank you so much for everything you do every day to be able to do these events. Thank you so much.
All right, nicely said. All right, last call. Go get yourself some water, use the restroom if you need to.